Hello everyone. So it's been well over 3 weeks that I had the ORIF surgery, open reduction internal fixation on my ankle. I had bimalleolus fracture, which required surgery to be taken, and still my foot is in a cast like this, and I have to keep it in this cast for the next 1 week till the end of week 4, where the cast will be removed, and then from there I will start the physiotherapy. The most difficult part of this was the first 2 weeks. The first 2 weeks, you have to keep your foot as elevated as you can, as much as you can to keep it elevated. And this has been the place where it has been my resting area. I am confined to my house now, and I haven't left it unless it was really extremely necessary. For instance, after 2 weeks, I had to see my doctor to get the stitches out. And I want to show you how I kept the foot. Most of the time, when I was sitting in this place, I was keeping my foot in this way. And one of the important things about post surgery rest and things that you can do to expedite your recovery is to keep your foot as elevated as much as you can in this position. Basically, the foot has to be above your heart and waist. So, whenever you're just watching something, you could prepare a place where you can easily do this kind of thing. So, it hasn't been easy, it has been challenging, but the most challenging part was the first 2 weeks. In the first week after the surgery, the pain was much more. Even when you were moving the leg, you would feel like the wound is painful, as well as the bone. Those screws which are attached to the bone to keep it into place. That will take time for them to set in. But at the end of week 2, little by little, you feel like things are getting slightly better. And now that more than 3 weeks have passed, I don't have much pain on my foot. I still cannot put weight on it. I shouldn't put weight on it until well after week 4 or week 5. That depends on week 4, where I will have another x-ray, and that x-ray will decide whether I can begin little by little to put weight, or maybe I would need to wait another week or 2 before weight bearing. It also depends on the type of the fracture. My fracture was a small bone. A small part of the bone had been detached from the main bone, and my surgeon said that for that type of fracture, we would just let the bone to heal before we begin to put weight on it, which is more or less it's the same for any type of fracture. So the most important thing is to keep it cool. It can be frustrating, so mentally preparing yourself for post-surgery, I think, is very important from the very early stages. You are not going to be able to do most of the things that you did before the surgery. Your mobility will be very limited. You are confined to crutches. I've been using these 2 crutches, and I think I'm going to use them for the next couple of weeks as well, even during the time that I begin putting weight on it, and but it will pass. So it's been well over 5 weeks that I have had the ORIF surgery on my ankle. I had bimalleolus fracture, which required surgery to be done. And at the end of week 4, exactly a month after the surgery, the cast was removed. And right now I only have this bandage here. The wounds have healed. There is still some swelling, so that does not allow the range of motion to be 100%. And I have been given some suggestions of doing certain exercises with my ankle, basically taking it back and forth. And also, very little weight bearing has been suggested that I would do it on my ankle. I've been told to walk on the tip of my toes with a little bit of weight on the ankle on that foot itself. Though right now the condition is much better. I can actually stand on this ankle. I can actually walk on the ankle with a little bit of difficulty. There is very little limp there. But from tomorrow, I'm going to start the physical therapy, and then within the next couple of weeks, I hope that the range of motion will return and I could be able to walk more properly. So, one of the things that also has been instructed to be done during this time between the removal of the cast and beginning of the physiotherapy is that I merge my foot into warm water and massage that area. I think it's got to do with the blood circulation, and it's got to do with getting the strength back to the muscles. So right now I'm going to remove this bandage over here, and I'm going to go to the bathroom and put my foot into warm water and do the massaging there. So as you see, this is my the inner part of the ankle where the incision was made in this way. So there is one screw here, and this part, the incision was made from this part and it went all the way down, and there is a rod here with 9 more screws to keep that bone in line. As you see, there is a little bit of swelling here. It's subsided. This part is still a little bit more. And if you look at my 2 feet, right now the condition is better, but still my left foot is a little bit bigger than my right foot. So right now I'm going to take this foot to do the massaging in the warm water. Okay, this is the bathroom. I just want to give a hint about how you can take shower when you have a broken ankle. This has actually been the position in which I have been taking shower and washing myself. Just sitting on the toilet, it's not very convenient, but if you have a shower that's extended, like this one, you can easily wash yourself, and in order to keep your foot dry, which you have to get it dry, keep it dry when it is in the cast, you can use one of these plastics which has been specifically designed for keeping your foot dry. This actually is taken into the foot, and this part would be over here, and I've never had an issue with this one. You can order this online, possibly from eBay, Temu, or Amazon. It's not that expensive, but it is ideal for keeping yourself and your foot dry at the time that you are taking shower. I know that many people avoid taking shower for the fear of making their foot wet, which the cast should never be wet because of the possibility of infection and all those things. And this would work really well with someone who has a broken ankle or a broken leg. And now here I am just going to put my affected ankle, my left ankle, into the warm water, and I'm gently just going to massage those areas which are affected. This really helps soothe the feeling. It helps with blood circulation, and I've been really good. It's also a very good way of removing all that dead skin that you are going to have after the cast is removed. You need to consider that once the cast is removed, there will be a lot of tension. Your muscles will be tense, and your muscles will not feel exactly the same. It will take some time for the muscles to gain their strength back and to be able to keep the weight of the body on that part of the affected foot. One part of it is the bone. Once the bone is healed, it's not the 100% process. That's why we do physical therapy, to regain that range of motion in the ankle. and one part of the range of motion is the bone and how strong the bone is, and the other part is the tissue and the muscles which are attached to that bone. So all of them should be strengthened until you have 100% of the range of motion in the ankle. I would also have to say that for each person and each fracture, it is different. I am in this condition where I can put weight on this ankle 5.5 weeks after the surgery, but I'm not a medical practitioner, so it's not suggested after 5 weeks you can put weight. Always consult with your surgeon, specifically your surgeon, for the best advice, because the type of the fracture determines the process that you take to make it strong again so that you can begin walking and putting weight on it and do your daily tasks without issues. So you shouldn't keep the foot in the hot water, in the warm water, it's not really hot, for more than 10 minutes. So it's like 5 to 10 minutes of keeping the foot here, massaging it, and just let the foot rest. And in the meantime, you can also do some exercises in the water. You can lift your toes up and lift your heel up. These are some of the exercises that you will be doing once your cast is removed. So this is really a good way of regaining of that strength that you should do. So exactly 5.5 weeks have been since I've had the ORIF surgery on my left ankle, and today was my first session of physiotherapy, and I've been given the green light to ditch one of the crutches and to take short steps with the crutch on my left side. And it's been okay. I feel fine putting pressure on my left foot here. It will take some time for me to gain my confidence and to strengthen the muscles in the left foot to bear the full weight. I have tried to put full weight on it just for a few short steps. Still, there is a little bit of tenseness there. It's stiff, but I'm looking forward to getting it better. So, but as I said, this is actually a case-by-case issue. For me, the healing process went pretty well, and right now I have 2 weeks short of the 6th week, exactly since the time I had the surgery, and I am able to take steps like this with only one crutch, and I'm actually feeling okay. I'm just getting that momentum of walking. At first, it was a little bit difficult. It's mainly to do with your confidence and your mentality, actually. At first, I was a little bit afraid of putting much pressure on it. I was just concerned, which is really, natural. But after a while, when you do the physiotherapy, you will regain that confidence, you will regain that sense of trying to walk as soon as you can. And for me, the result has been fine. However, as I'm not a medical practitioner, I re-emphasize this, that your surgeon is the best person who can advise you when you can begin putting pressure on your affected foot. I can actually stand without any issues. I don't feel uncomfortable on my left foot while standing, where the balance is like 50-50 on both legs right now. There is still stiffness, there is a little bit of discomfort. It's not like 100%, that would take time. The foot is still swollen, and that swelling may rise when you put pressure on it. My orthopedic surgeon said that that's actually normal for the next couple of months to have the swollen leg. Though for that one you can do ice pack and you can do compression and also elevating the egg to bring it down. Anyhow, the progress has been tedious. To stay at home for like 5 weeks in a row, not do the things that you enjoy doing. But at the same time, if you take care of yourself well, if you keep your foot elevated and just minimize your movement during these, especially first couple of weeks, you can expect to have a speedier recovery